I think, therefore I am. This is the first principle of philosophy, first coined by Descartes. He said that because he could think and doubt, that was the only proof required that he was alive. He was the first person to start talking about the brain-mind divide. He first started this debate in 16th century, but this debate goes on until now. Would it not be nice to know how much of you is your brain? Are all your intuitions, empathy, hunches, belief are just some part of a neural circuitry? Or is there a structureless, non-physical entity called mind that governs us? If it is all brain, then why doesn't the same medication work for everyone? Or why does the behavioral therapies work? If it is all mind, then why do medicines work? Why do the other electrical, electromagnetic, and chemical therapies work? And what do we say about people who say they think from the heart? For me, the brain and mind divide is rather arbitrary. Diseases like headaches, Parkinson's, dementias, head injuries are not neurologic or psychiatric anymore. They're rather neuropsychiatric. This is the first case of neuropsychiatry. This man, his name is Mr. Phineas Gage. He used to live in America and he suffered a blast accident. When he was working in a mine, the iron rod that he's holding went through his skull. He survived the incident but was left with permanent neurological and behavioral changes. He was the principal case that made us agree that brain damage causes personality changes and that different parts of the brain have different functions. And any damage to those parts will cause an impact on the functioning of the brain. This conclusion led to the first development of psychosurgery or surgery for psychiatric disorders. Initially, this was used for diseases like psychosis, personality disorders, or depression. In a very crude manner, an instrument was passed into the brain from just top of the eye and some connections were cut. This was a misadventure because a lot of people lost their life or died because of the procedure. The procedure, this was used in around World War II times, was subsequently abandoned, but it subsequently led to the development of the modern psychosurgery or deep brain stimulation. Deep brain stimulation or DBS was again initially started with neurological disorders like Parkinson's and other movement disorders, but now it is being used for things like depression and obsessive compulsive disorder. Would it not be nice to have something that you can just tune up when you're feeling a bit anxious? It might just be true. So in deep brain stimulation, two electrodes are placed in your brain and they're connected with a wire to an electronic pulse generator which is implanted in the chest cavity. The electric current generated by this battery stops the extra or aberrant neuronal activity and thus it helps the patient. Brain stimulation is nothing new. We have been using ECT or electroconvulsive therapy successfully for many decades now. But things with DBS are rather different. It is a brain surgery which comes with its own inherent risks like paralysis, bleeding and infection. But also it comes with several moral and ethical questions. The DBS electrodes can be placed in areas that make us feel better or enhance our mood, but they can also be used to reduce certain behaviors. They can be placed at parts where you can take away the pleasure associated with people who may be serial offenders, rapists or murderers. But is it appropriate or ethical to use it in that way? Yes, it can be used to improve the mood, intellectual ability, confidence, but should the patient themselves be given autonomy to manage the same, such that they can just tune it up when they're going for an interview or giving a speech like I am giving today. Having said this, we all already modify our mood with use of caffeine, alcohol or drugs, but is DBS also should be used in the same manner. When we stimulate a certain area of the brain, it is not just that one area that gets stimulated. The surrounding areas also get some electrical activity. This leads to side effects. The side effects, one of the common ones, is increased impulsivity and gambling in people who have DBS implanted. This will make one wonder that who should be blamed if things go wrong, the man or the machine. We know that people who drink drive and have accidents are charged for the same. But would it be appropriate for the DBS patients to be charged in the same manner? Because it may just be a side effect of their procedure. When you have these electrodes put in your brain, they are controlled by Bluetooth or by Wi-Fi connection, which means a second person, most likely to be a doctor, who has control on your movements and to some extent on your thoughts and actions. There are real concerns about brain hacking and that people can be made to do certain things or stopped from doing certain things depending on the stimulation area and levels. Let's move on to another innovative technology called the brain-computer interface, or BCI. The human mind and machine continue to co-evolve and merge. Neuroscience is at a level where we can make a recording from a single neuron. Come to think of it, we have more than 1 billion neurons in our brain. In the next video, just going to show you some recordings from brain tissues. In brain-computer interface, electrical recording is made from a specific part of the brain. This electrical activity is fed into a computer, which then translates it into some sort of a physical activity, which might be movement of a wheelchair, lifting up of a prosthetic arm, or production of speech. There is a real role in rehabilitation treatments for BCI, because people who may have spinal injuries or brain injuries can have some movement or actions secondary to having the BCI procedure. The brain-computer interface could be an invasive procedure, semi-invasive, or a non-invasive procedure. The semi-invasive and the invasive procedures have the same sort of side effects that a DBS might have of infections, bleeding, and possibly paralysis. There is a role in assessment of psychological states and looking at stages of sleep with BCI. There is also therapeutic role in management of pain and a possible role in management of depression, anxiety, and phobias with BCI. Again, the risks remain of brain hacking, and also that we still do not understand the full complexity of the procedure. When Descartes said, "I think, therefore I am," there was no concept of artificial intelligence. Can artificial intelligence think for itself? The answer is yes. But is it alive? No. AI is already being used in neurology and psychiatry. What if your phone, tablet, or computer can tell you that you seem to be feeling a bit low today? A large proportion of people who go on to commit suicide would search on the internet for the means to do so. Can alerts be raised so that help can reach these people and lives be saved? Machine learning models are being developed to predict suicidality and to predict psychosis. They can do this by looking at the keywords in your speech or in words that you're typing over the internet. There are special MRIs which can click images that can help us in predicting psychosis as well. The use of AI is very interesting. There is a dearth of psychiatrists and psychologists in the country. There's about a third the number that is required for the country for psychiatrists, and about a tenth of the number of the psychologists that are required in the country. Add to this, the availability is only in Tier A and Tier B towns, which means that 70% of the population does not have access to psychiatrist or psychologist in the country. There is a dearth of neurologists as well, with only about 1,200 recognized neurologists in the country 3 years ago. The number might be up to 1,500 by now. Add to this the stigma and the taboo in going to visit somebody for your mental health. The society doesn't like it, and the people do not want to come forward. Add again the cost associated with seeking treatment and the time duration. This is really true for most of the world, where there's an acute shortage of mental health professionals. AI and computer-based programs are therefore getting a lot of traction in this field. There are computer programs and apps which are commercially successful and show that they can help improvement in person's mental health. Our thoughts, emotions, behaviors are therefore a complex interaction of biological, individual, and environmental factors. It therefore makes sense for the same person to look after both the brain side of the things and also the mind. It could either be a neurologist or a psychiatrist. The criticism of psychiatry has been that it is not an exact science, that we are unable to show like neurology has been able to show on brain scans or on blood tests. But I can tell you that we are closer than ever before to be able to have commercially available scans or biomarkers to do the same. I do believe that maybe not in my lifetime that the two specialties will have to merge again. We have to move forward from looking at a patient and saying this is a brain problem or this is a mind problem, and work holistically and give a better treatment. Thank you.